go, Arthur. You'll be okay, won't you, bud? There we go. Let's get you in.
Hi, Greenie.
Hello.
Hey.
Arthur.
Perfect. I'll mark you in and we'll be with you shortly. Just grab a seat.
Thank you.
Meet 12-year-old rescue cat Arthur with his owner Karina.
Arthur came into our life from an animal sanctuary just outside Bristol. We adopted him after seeing him in their adverts, really. He was diagnosed with feline diabetes, and they made that very plain on his adoption form. There was something about the pre-diagnosed condition that kind of made you want to help out if you could.
Hi.
Hello
You
there.
got Arthur?
Hi. Yes, I have.
Do you want to come on through?
Thank you very much.
It's estimated that about 1 in 200 cats has diabetes.
Come on in.
That's over 60,000 cats in the UK. Vet James is in charge of Arthur's case.
Ah, hello.
So, Arthur
Yep.
is a diabetic.
Oh,
Here he is.
he's very handsome.
He's
He is.
gorgeous.
He is, and this fluffiness is
Yeah.
gorgeous.
On the whole, he has been stable in the past, but his diabetes has hit a bit of a rocky patch again. So we are monitoring and trying to work out what his glucose levels are doing.
And to help with that, James is using the latest tech.
This is what we call a Freestyle Libra. So this is a new bit of kit. What this does is connects to Karina's phone, and it will actually read Arthur's blood glucose levels
Wow.
over 24 hours.
I've seen these on humans.
Yeah.
Right.
But yeah, they are amazing.
Oh, and diabetes is something that older cats get, or?
So diabetes in cats is relatively common. So it's basically where there's either not enough insulin being produced or the body isn't responding to the insulin in the normal way, which basically means that they can't control their own blood sugar levels. So very similar to how we see with people, it means that we end up most of the time injecting them then with insulin.
Insulin is a hormone that helps us and all mammals to regulate blood sugar levels.
You have to administer that, do you?
Yeah, so twice a day by syringe.
Oh, and he tolerates that.
Yeah, he was very good, actually. Yeah, when we adopted him, his foster care had got him quite used to it, but I think from day 0, he was fairly good with it.
Arthur's clever gadget monitors his blood sugar 24 hours a day.
Okay, let's have a little look at your results then, Arthur.
The app on Karina's phone allows her to print out graphs showing the ups and downs of Arthur's blood sugar level over recent days.
And you can see it spiking up and down, up and down, up and down. And that correlates both with the insulin wearing off, but then also he's going to have food. So where you can see this curve going up to the top, it's where the insulin's worn off, so that's where he needs another dose of insulin.
The aim of the treatment is to moderate Arthur's blood sugar level and make it less erratic.
If we leave diabetes untreated, it can lead to secondary problems, things like cataracts, but in worst case scenario, it can actually put them into a coma. So what we're trying to do is keep them in a nice band in the middle. One thing that we could maybe do is run a blood test looking at something called fructosamine, which is almost like a historical test. So it tells us what the blood sugar levels have been doing on average over the last 3 weeks, which is quite a nice way to kind of look back and go, on average, have we had good glucose control?
That's incredible. Yeah.
So I think that might be quite a good thing for us to do today if you're happy with that.
Yeah, absolutely, yeah. I think it would be a good thing. Is he going to climb in?
You might, yeah.
Do you want to see if you
your
can get
belly
back
pose?
in your... No, it's pretty chill.
Oh, yeah,
Oh, here we go.
love
Yeah.
it.
He's like, actually, oh, okay.
He does it in his own time.
Absolutely.
Yes, that's cats.
As you should.
Ably assisted by vet nurse Alice, James collects the blood sample from Arthur.
Your hand is actually beautifully positioned for me to lean on.
Glad I can help.
Thank you.
He's such a good cat.
James is hoping that lab tests on this blood sample will give him a better picture of Arthur's blood sugar levels over the past 3 weeks.
Okay, here we go. Right, lovely. We'll get those bloods sent away and we'll give you the recall results and we'll go from there. All right, okay, we'll speak to you soon. Take care. Bye.
Next, vet nurse Ella checks in 8-year-old Eddie for a biopsy.
Good boy. How is Eddie today?
He's all well.
Hi, pal. Good stuff. Okay, so today we've got Eddie in for a general anaesthetic and a little lump removal on his chest. Is that right?
Yeah.
All righty, bless him. What we'll do then is we'll take him on through, get him all settled in a kennel, and we'll give you a call with an update when we can.
Good boy.
He's lovely. We'll take him out the back then and get him sorted. All righty.
Hi, baby.
We'll give you a call when we can.
Thank you. All right.
Good boy. Good boy.
As Eddie is Amy's patient, she'll be performing the surgery to remove the lump. Eddie was originally owned by Sarah's son, Michael, who tragically died from a brain tumour in his teens.
He's definitely very special in Sarah's family. So he was Sarah's son's dog, who unfortunately isn't with us anymore. So definitely means a lot to Sarah, and definitely meant a lot to her son Michael as well, and helped him through a lot. So yeah, all of our patients are very special to everybody, but he in particular is very special to Sarah.
And when did you find his lump?
So his owners noticed it a few weeks ago, and they were keen not to have to operate on him unless we really needed to. So we did a couple of investigations to try and work out whether this little lump here on his neck is maybe about the size of a blueberry.
Without a laboratory test, it's impossible to know if Eddie's lump is benign or malignant.
So a benign lump's a lump that we don't need to worry about. It is a lump, but it's not going to spread elsewhere.
Yeah.
It's not going to...
Just part of the ageing process.
Yes. Whereas a malignant lump would be sort of a cancer that's going to spread elsewhere and cause problems. So we'll cut it out today, and then we'll send the entire lump to our external lab, and they'll have a look at it under a microscope to tell us then exactly what the lump is.
Okay.
Whether
And
it's...
then any further treatment
We
you
would
talk
then
about
talk
from
about
then?
afterwards, yeah.
Okay. The weight of what you're doing is huge, because for the pet owner who's waiting, I mean, this animal is everything, part of the family.
Yes. It is very much at the forefront of our minds when we're in a consultation talking to those owners and to the families.
Because you've known Eddie all his life.
Yeah,
7,
so we
8
first
now.
knew him as a young puppy. So yes, he's a lovely dog, and he's definitely seen his family through a lot, which makes him extra special for them.
Amy shaves the area around Eddie's lump, ready for the operation.
Even this bit you have to do with infinite care.
Well, it's the bit that the owners see, so they like a neat clip. Let me give it a little hoover.
Anything to keep the surgery nice and tidy.
He's a lovely boy, isn't he?
Eddie's in safe hands as they finish his surgical prep before he's transferred to the theatre. As this is a minor operation, I don't need to scrub in or wear a mask.
How's his anaesthetic depth, Ella?
Yeah,
Okay.
He's good to cut.
Happy if I cut?
Yeah.
Yeah. So I'm just going to start cutting now.
Yes.
So we make a little elliptical incision around the lump through the skin. And because I don't know exactly what this lump is, I'm taking a fair margin of normal tissue around the outside of it.
So you don't want to actually puncture that
No,
in case
so you,
anything escapes?
so you want to take the lump in its entirety,
Yeah.
and hopefully with a bit of normal tissue around the outside. The cancer cells can be in the local tissue but not part of the main lump. So you just want to take out enough tissue that it's unlikely that you're going to leave any of those potential cancer cells behind.
You're all right there, darling. When you wake up, it'll be gone. There we are, getting that out. Whatever it is. You've done lots of these, I suppose.
Quite a few,
Are they
yes.
quite common?
Lumps are very common, yeah. Some are more straightforward than others. Now it's about closing up the defect, really.
And those will be dissolvable?
So these are all dissolvable stitches going in now, yeah.
And then how long does that last before you know the wound is fixed?
About 10 days time.
10
Yeah,
days.
10 days the wound will be totally healed. So Eddie will have to be walked in a controlled way for the next 10 days. So he'll just go out for walks, but staying on the lead. We don't want him to do too much that might risk bursting his stitches open.
Yeah.
Which in the long run will mean a much quicker recovery time. So Eddie can get back to doing what he wants to do in his normal life more quickly. So yeah, so this will be the last stitch now.
He's remained stable, really, hasn't he?
He has, which is what we like.
Yes, no drama.
Two days after the lump on Eddie's neck was removed, his results are in.
A bit nervous. Hopefully it's good news. Yes, which it is. That's really good news. So it's something called an infundibular cyst, which is a non-cancerous kind of dilation of the hair follicle. So now that we've excised that lump, it's completely curative. So Eddie is A-OK. He's going to be great. So I'll just give Sarah a ring. She'll be really excited to hear. So yeah. Hi Sarah, it's Amy calling from the vets. Hiya, it's really good news. So yeah, so don't worry, he's fine. So nothing cancerous whatsoever. So we can not worry at all. So that's all we really need to concentrate on now, is just getting that wound to heal nicely. And there's no reason why that shouldn't. Presumably he's okay and everything's okay from your end? Good. I knew you were worried, so I just wanted to get those results back to you as soon as we could. All right. Thanks, Sarah. Take care. Bye. She's delighted. Obviously, there's a lot of history with Sarah and Eddie, so I'm really pleased for her that that's come back as benign.
I thought you were a vet, not a dentist.
Fern Britton Inside the Vets, brought to you by Petplan.